Thank you. Give your call to the member for Granville.
Thank you very much, Madam Deputy Speaker. The fact is you can be strong on borders without being weak on humanity, and that's what this legislation is about. Why do we support this legislation? We support it because of our commitment to basic humanity. Basic commitment that says if someone is sick, you should look after them and give them care. A basic proposition that says that these people are our responsibility. Basic principle that you shouldn't just turn your back on suffering. And that's why we worked and tried to work across the parliament, but particularly worked with the crossbenchers to achieve this outcome last year. The fact is that the only person undermining border security at the moment is the minister with his rhetoric, who sends a message each and every day at every opportunity that somehow the legislation such as this undermines our national security, undermines our border security, when he knows, in fact, that this is not true. But then again, this is a minister who is an expert at inflammatory rhetoric. It's not surprising that on other issues that are being debated in the national political arena at the moment, such as a voice to this parliament for First Nations people, the minister is stuck with the line that it's a third chamber. Even the member for New England has reversed that position, but then again he did walk out on the national apology. We should always remember that that was his response there. Now, the minister knows full well that the border argument is a nonsense, because the legislation passed by this parliament only applies to people who were already, at the time of the passing of the legislation, on Nauru and Manus. Anyone who arrives by boat or attempts to arrive by boat simply isn't eligible, isn't relevant for this legislation. It's as simple as that. And that was a sensible proposition to ensure, if there was any doubt that this legislation would provide a pull factor, that it could not. And that is why this is simply not a fact from the minister. The way that the minister has told it, the moment the Medevac legislation was passed, the horizon would be full of an armada of boats. Remember that? They were all going to be here within days. Everyone on Manus and Nauru were going to be here, and there'd be an armada on the horizon. We had the infamous media conference on Christmas Island. The palm trees at Cronulla Beach would have done the same job. They could have got some little plastic red crabs, pretended it was Christmas Island there if they wanted to do that. Warren could have provided it, the member for Lingari, because it's in his electorate, of course. But they had that extraordinary press conference in order to create fear, promote division, and of course none of their rhetoric has matched the reality. We're now at July, some 7 months after the legislation is carried. And what do we find? What do we find is that of those people who have been brought to Australia to receive medical assistance, less than 10% of those have been brought under this legislation. More than 90% were brought without this legislation. So 90 brought here under this legislation, but there were pretty close to 1,000 people had been brought here already. So the minister's own rhetoric as well, of course, is that the boats that have attempted to come here since this legislation was carried, of course, haven't been from the north. They've been from the west. They've been from Sri Lanka. Sri Lanka had a devastating terrorist attack over Easter. And in the wake of that, there have been some boats arrive here. Now, I don't know what the motivation of people, because I'm not privy to that. The government, of course, is privy to that, and so a journalist briefed by the government about these national security issues for political partisan purposes briefed on that. But what I do know, of course, is that those people have been returned. That's the government's policy. That's Labor's policy. That's not an issue for this legislation whatsoever. You know, maybe the minister could actually have a read of his policy just to jog his memory about it. You know, take up the Prime Minister's dictum of, you know, how good's reading your own policy. And maybe that would be a good thing. Because, you know, when you have 1,000 people brought here by the government itself and only 90 going through the Medevac process, it's hard to see why the government is putting this position forward. Now, even for someone who appears to struggle with basic facts as much as this minister, the legislation is very clear. It's very straightforward. It allows for the minister himself to appoint the committee that makes the decisions about medical evacuations. So really, the minister's position on this is a vote of no confidence in himself. Because he appoints the committee that makes the decisions, and he says that's a disaster. So he's calling himself a disaster, the minister, in terms of his position. You would think that that had escaped his knowledge. But of course, the legislation is working. It works as it was designed. A number of the objections have been held by the committee when issues have been upheld, when the issues have been raised. Given that his committee's been a success, the minister shouldn't be coming here with this legislation. He should be giving himself a little pat on the back, for doing so well. He could even practice his smile. Remember that? How good's the smile? How good is the smile? Let us smile. Cheer up, son. It's not that bad. Your legislation's working. Your legislation's working. You are. I don't know. He's the most miserable winner of an election I've seen. He's come over there. They should they should cheer up. But instead of that, what we're seeing is a government acting on its only instinct. I mean, the member for Warringah's gone, replaced by a much better version, it must be said, and who gave a terrific first speech in this place. But his spirit lives on. Just this determination to oppose things. Even opposing himself now, this minister. They've gone to the next logical step, really, of saying no to everything. Now they're saying no to this legislation, which the minister is in control of because he appoints the committee and presides over these processes. So I say to the parliament that they should reject this attempt to undermine this legislation. We should be proud of the fact that we've carried legislation in a difficult area that's making a difference, which is consistent with the government's own policies, because it does nothing to undermine our borders, which is very important that occur. This is just all about politics. I mean, you know, they sat around in their tactics committee and they worked out what have we got for the agenda for the third term, and they've gone, we'll just do, we'll just oppose the Labor Party and we'll just work out where we can have a little wedge, and that's what we'll advance on. Well, you can't do that for 3 years. You can't do that for 3 years. And this legislation should be rejected to undermine legislation that is working, that's consistent with the framework, that doesn't provide any pull factors, that's providing health care for people in need. And that is something that is just basic decency, basic humanity, and that's why the parliament should continue to support the Medevac legislation.
Thank the Leader of the Opposition.